Hello and welcome. I'm Arjun Vishwanathan, the Chief Knowledge Officer at Strategink, and we're immensely pleased to welcome you to Vision 2022, the Future of Next, an event that promises to lift the veil and the curtains of the benefits and the power of technology to radically alter business outcomes in 2022 and beyond. In this particular segment, that's very aptly titled the CXO Agenda, Altering Tomorrow's Course of Life, Grit, Opportunity, and Scale. I have two very eminent gentlemen from within industry to speak about the whole evolution and maturity of technology and its convergence with business strategy. Both these gentlemen are from sectors that are critical to the rise of India today. Please put your hands together to welcome Mr. Atanu Roy, Group CIO for the Biocon Group. Atanu, sir, welcome, delighted and privileged.
Thank you, Arjun, and very happy to be here along with Arvind.
Thank you. And certainly somebody that the industry knows and a personal friend, Mr. Arvind Sivaramakrishnan, the CIO for Apollo Hospitals. Arvind, sir, welcome. Equally delighted and privileged.
Thank you, Arjun. Pleasure being here.
Wonderful. Gentlemen, we've got a fantastic 30 minutes ahead and what promises to be a wealth of experience and knowledge sharing. Because Atanuda, if I could directly come to you, we've seen the last 2 years, and if you were to look forward, in your perspective, how do you feel that the years 2020 and 2021 have radically redefined the use of technology in business transformation? What are the opportunities, and clearly, what are the challenges that we faced, and what are going to be the opportunities as we move forward?
So Arjun, if we look at the pharma industry, the important factors for us, the desired business outcomes is how do we do drug discovery faster? How do we get products faster out in the market, get approvals faster and launch products faster? So the speed of drug discovery, product development is one of the desired business outcomes. And the other business outcome is overall manufacturing effectiveness. How can we manufacture products at scale and bring it to the market faster? So one is to discover the products faster, drug discovery, and then launching the supply chain part of it, manufacturing effectiveness. What had happened in the second wave of COVID, in the month of March, there was one product called litolizumab, which we used to make. There was a demand of about 200 units per week, and that had climbed suddenly in the month of April to 7,000 units per week. And neither we had the raw material nor the capacity, and that is where, but we had to meet the market demand because that was very necessary. And that is where the productivity increase and the scale up with whatever capacity you have. How can you respond to the changes in demand and the needs of the market in a short span of time is extremely important. So the responsiveness and the agility of the manufacturing and the supply chain is also a very important product and a very important dimension. And for most of the pharma companies in India and elsewhere, there is, and more so for the pharma companies in India, the number of products we make in a factory is very huge. The portfolio is very huge. And that is where the responsiveness of the supply chain to use the same manufacturing capability to make different products and distribute it across the length and width of the country and also the world, because Indian pharma companies have their supply chain spread throughout the world, is extremely important. The third dimension is how do we get closer to patients and customers in this remote scenario, and how do we ensure delivery of the products? How do we ensure that the doctors and patients are connected? How can we help in that ecosystem? And linked with the product itself, the product drug discovery itself, and the launching of the products, clinical trials in such environment to do it quickly becomes also very important.
That's a very fascinating view, Atanuda, but with your permission, I'm going to take that exactly to Arvind. Arvind, healthcare, you had a roller coaster of the last 2 years. What have been the learnings of how technology can radically redefine healthcare provision in India in the years ahead?
I think if you look at the last 2 years in technology, the first part I would say is the trust that technology is a main stage player, I think that has been well established. It's not like technology was never used. It's not like anything that was done is new. But I think with healthcare, particularly with healthcare, though what I'm saying may not be true with the rest of the e-com industry and all of those, e-com and the transportation industries. But the trust that this is reliable technology that can take care of healthcare transaction without losing the personalization aspect of healthcare, and that it can happen in a manner where effectiveness of patient quality or clinical services is not downgraded and is maintained and is measurable at the same. I think all of this has been reinforced very clearly. By doing so, the other part that has come out very clearly is by using technology, how can we look at capacity building in the whole healthcare environment? Because obviously we had a very difficult situation where there was a physical shutdown, where people were not allowed to physically move, but healthcare still has to continue for different types of illnesses. And I'm completely keeping aside the pandemic. Assume the pandemic is removed out, but there's still the rest of healthcare that had to be there. So that sort of a capacity building started happening. The second aspect that started happening to what Atanu was mentioning also was redefining, reinventing, and realizing that whole aspect of customer centricity. The whole and when I say redefining, again, it's not something new, it's not something that was not known to us, but the accuracy and the efficacy with which it is done and the seriousness of how doing that effectively matters to the whole picture, the whole care process, the outcomes, the manner in which somebody is being treated, all of those. So using technology for reinforcing and reliving customer centricity. That I think brought in a whole picture of effective healthcare delivery.
No, that's actually fascinating as you're actually articulating it, because that's exactly what I wanted to bring to both of you in this next very, very critical question. Is that Atanuda, Arvind, of course, Atanuda, I'll come to you first. Your roles today stand significantly and supremely altered, and now become more business enabling and strategy enabling, as it were. And therefore, in that kind of a situation, how do you blueprint your technology strategy to be able to adequately and judiciously, in a prudent manner, balance innovation, incremental business outcomes, as well as fiscal prudence?
So, this is actually a multi-dimensional question, but so, the business outcomes is actually quite important, where we are looking at faster drug discovery. How do we launch products faster? How do we make our supply chain more responsive? So we are looking at solutions which can make that happen and which is scalable. So there are multiple solutions which can make that happen. But overall, the architecture to make it cost effective and frugal is also extremely important. So how do we architect the solution so that the components of the solution can be reused in various areas to make it frugal? For example, if I have to do faster drug discovery, apart from digitization of the core processes, I would also use artificial intelligence, machine learning to help in the drug discovery.
True.
Now, the same digitization would also be applicable in the quality labs and in manufacturing. And the instrument integration, the way I integrate instruments in R&D, I would integrate instruments similarly in the quality labs as well as in manufacturing. So that is where I will reuse some of these components. And that would help me in making, in the judicious cost, which you talked about, and frugal innovation and reusing by design. We are architecting such that these components are reused elsewhere in a systematic manner rather than an afterthought. This other part is, for example, when we are using artificial intelligence, machine learning algorithms in R&D for faster drug discovery, I also use that in clinical trial, and the same models I try to use in manufacturing to increase my yield effectiveness. So that is where we are creating an enterprise architecture which has the business outcomes in mind, and the building blocks are getting reused appropriately across the value chain rather than redoing it in all the places independently. So that is how we are balancing the business outcomes, the strategic outcomes which we want to achieve, and we want to do that in high speed, at pace. So that is broadly what is used, and also having a very strong core team of individuals to make that happen, because a strong team is also extremely essential to do it at a high speed, because speed is of essence here, as well as meeting the business outcomes. How do we align with the strategy of the business and do it cost effectively?
No, that's actually very interesting, because Arvind, same question, but I just want to give it a flip, which is yours is a brick and mortar business. In that sense, what does being truly digital or truly digitally native mean to you today in the healthcare sector, with and while balancing exactly the same thing: innovation, business outcomes, and of course prudence in costs?
Arjun, first I will challenge the very thought of describing healthcare as a brick and mortar business.
That's interesting.
And the reason I'm going to do that is, how can we look at delivering healthcare beyond the traditional nature of brick and mortar? So while Atanu mentioned that the question was multidimensional, I will call this it's a fourth dimension question, with efficiency, cost, and quality being the three dimensions, and strategy being the fourth dimension. So look at it in terms of making impact on the ground every day that is perceivable, and balancing the three dimensions. And also look at in using technology, and also having the guts to sunset solutions faster, so that you're able to adopt different methods, techniques, and or technologies. Okay, that in combination is where I'm bringing the fourth dimension of strategy, so that you are moving the business forward and you are preserving. Yes, healthcare is a regimented, discipline oriented. There is inherent fear that you need to be very careful, because every time you're dealing with a life, and no question of compromising that line of thought.
True.
But reinforcing that line of thought as, how can I bring in ether space into it, and ensure that that line of thought of quality and efficiency is never ever compromised? And how can we do it faster? And how can we do it better? And how can we reinforce that 24/7, 365? So bringing in those thoughts of technology, alternate technology in coexistence, so that logically one can disassociate and morph into the other and keep growing, and you don't carry the burden of technology. So in the other industries where technology has been much more prevalent, much before healthcare started using technology, because healthcare is a little late to this party, they're dealing with the burden of technology. We've seen for the longest time the manufacturing industry dealing with the burden of mainframes. I'm using the word burden of mainframes. It's lived its purpose, it's justified its purpose, and it's done a lot of things. But today, unfortunately, I am using the characterization of burden to classify this, which was a boon many years before, and it's done some fantastic work.
Indeed.
How can we not get into that conversation at all and start graduating technology and at the same time dropping off, and in the strategy building those inherent cost advantages, return on capital investment advantages, so that you are able to take those things, and it also take some U-turns in the event that certain experiments on technology are not apt or suitable to the nature of the business problem that is focusing our industry. It could work very well in another industry, but may not be apt for us. So how do we look at those? I think all those, if we look at technology bringing in, and then looking at how you're balancing strategy with, and here this cannot be an esoteric conversation.
It cannot.
You have to make an impact to the stakeholder.
Would you tend to agree, Atanuda? I mean, it cannot be an esoteric conversation that's up in the air.
No, absolutely, because it has to be delivered effectively, and it has to result in the stakeholders getting the benefits. Means there has to be a difference on the ground.
Yeah, measurable, quantifiable metric change.
And people will feel it, like, and especially in the healthcare, in the industry where Arvind comes from, patients, doctors, they see it every day, and it makes a huge difference. And the amount of change which healthcare industry has seen in the last 2 years is,
phenomenal. Now, Atanuda, in the same breath, therefore, you spoke about artificial intelligence and machine learning a short while back. Arvind's spoken extensively in the whole need for a cohesive strategy and one that is integrated with business outcomes. My question to you is, none of these is possible without a fundamental foundation of data. Yeah. Now, the volumes of data that, Atanuda, for example, in your sector or in Arvind's sector, that are being produced every minute is mind-boggling. In that kind of a scenario, when you're creating so much data, how do you progress on this journey of leveraging data to become insights and insights to become intelligence? And what, according to you, are the challenges? We know that the opportunities are immense. What are the challenges that you feel, and we'd love to hear from the audience too, from their perspective too, which is, what are those challenges that one must be careful and address in this whole journey when you have so much data with you?
So there is also an element of speed of generating the insights. And that is where the conventional work on the quality of data and what data you really need to generate the insights remains important. In today's environment, you have huge compute power. So there is a general tendency to take all data, and you have also the algorithms readily available, and run the algorithms to generate various insights and stuff like that. However, that soon degenerates into issues related to data quality.
True.
So the challenge is primarily getting clean data, extracting the data. Now, data from multiple systems were always available. The trick here and the benefit which we are looking at is when I correlate data from different sources. And that means we need to extract data from multiple sources. That is the first challenge. Can you extract data seamlessly from different sources, from instruments, from equipments, from the various IT systems? Are you sure that the data is not getting fudged anywhere in between? The consistency of the data, the correctness of the data is maintained. Here, the cost of data getting fudged, data integrity, cost of not having data integrity is very high. So clean data, 24/7, 365 days, extracting from multiple sources is the first challenge. The second challenge is, how do you create an intelligent data model to get the insights which we are talking about? Some people build it, but to sustain it for a period of time and ensure that the data quality doesn't degenerate is extremely important. And then the cybersecurity element on this data, that the data is secure while it is getting created, while it is getting transferred, and while it is resting, all that is important, and that becomes the third challenge.
Interesting, because Arvind, similarly, the healthcare of future is hugely reliant on hospitals, healthcare providers such as yourselves being able to judiciously leverage and put the data to use and to work. How do you see healthcare of the future, therefore, progressing from your point of view, and the role that data plays in it?
I think in terms of progressing, I think what we all need to understand is what problem are you trying to solve? And the moment you start realizing what problem you're trying to solve, you start curating that data in that direction. So we're getting excited that there is a lot of data, and we're getting all these statistics that every second so much data is getting generated, and then we extrapolate it over a year, then we extrapolate it over 15 years, and we come up with numbers that we can't even pronounce. Okay, but what problem are you trying to solve? So do you have a problem statement? The future of healthcare is not a good enough problem statement, because that's not going to help translate this data into insights. So the first aspect that we need to be looking at is solving for problem statements. Then looking at understanding positive data and negative data so that the bias is well balanced. After that comes the talent of the knowledge of the business process and understanding the behavior of the data, and the knowledge and the behavior of data science, and bringing this together in a holy mix. And because one cannot play the role of the other. Somebody might be a process expert and understand the behavior of the data, is not a data science expert. So bringing that together. And then the third aspect is applicability at what point. The common mistake that we seem to be making is expecting instant gratification out of this.
Possibly, true.
That needs some curation of data and some constant learning of the data, so that the positives and the false positives are aptly balanced. Sometimes it's okay to have false positives depending on the workflow you're talking of. It depends on the workflow. It's not always a right statement to make, but and now when you have this sort of an approach over a period of time, which now has to be rebalanced to be made aggressive. So whatever I'm not talking of let's take the rest of the next 10 years and do this stuff. No.
True.
Let's approach it as science and now overlay it with the urgency of reinventing, reimagination, and transformation. That's the sense of urgency. So the science of practicing and the urgency of transformation, I think we need to balance that and start getting to outcomes. And then the next aspect is look at interrelated correlation. Because healthcare is not an isolated topic. One can cause problems with the other. In our capital city, we had conversations about how the climate could be causing respiratory problems.
True.
You have interrelated, correlated problems. So can we start looking at correlation of behavior that are social, genetic, and that are societal in nature? So if you bring all of that, I'm looking at India particularly transforming into a healthy nation. And India transforming into a healthy nation is just not only about the science of healthcare, but it is also the physical aspects of the society we are in and the surroundings, the climate, and bring them all together. So the whole topic of sustainability that we are talking, if we can bring that in, and start defining the problem and its overtones, if I may say, I think you'll have a good symphony coming out of data to solve a healthcare problem.
That's fascinating because, Tananda, I'm going to bring that same thing to you. The whole concept of, and in your particular sector, which is drug research in the pharmaceutical sector, the overall aim is drug research for all, so that the entire nation stands to benefit. In that sense, becoming and our organizations moving towards a societal as well as a social aim or an endeavor. How do you see technology playing a role in your particular sector to be able to more wide base the application of drugs towards every citizen?
Another important dimension to this part itself is how do you work with governments and agencies to collect real world evidence. And as a company, we are working with various primary healthcare centers, helping those primary healthcare centers to collect data, and working with governments to help them analyze many of the data and the trends and statistical analysis, which can help in focus delivery of drugs early in the stage of the disease, to prevent its so that patients are treated much earlier at the primary healthcare center itself. On the average, modern healthcare system is available to about 10% of India's population. So this has to be delivered very efficiently. And that is where, if patients are caught early in their in the life cycle of the disease, then it can be prevented from it becoming more severe. And that is where many of the solutions we are working for drug discovery or yield improvement in the manufacturing, and those solutions, we are taking it also to the primary healthcare centers, working with government agencies, collecting that data, and then assimilating it along with government agencies, so that the primary healthcare centers are more effective to prevent severe diseases from happening.
Interesting. Gentlemen, this is becoming a fascinating conversation, but I do have a view on the clock. We've got about 5 minutes going ahead. Arvind, I come to you first. When you kind of boil down the learnings of the last 2 years and you look at the opportunities and the spectrum of opportunities that present themselves this year and beyond, there's going to be a vast chasm that we will have to kind of cover. In that sense, to this wonderful audience that's tuning in and listening to us today, what is your essential guidance to a new generation of IT leaders, practitioners, CIOs, chief digital officers, and so on, in the efficient use of technology to drive value acceleration and obviously superior business outcomes?
My first line of thought on this, Arjun, will be know the problem you're trying to solve. And in the urgency to bring technology to solve problems, it's not always the need to have the latest, greatest, cutting edge or bleeding edge. As long as the technology, so focus on solving the problem and don't focus on showcasing technology. The second aspect is look for scale and sustainability. Doing a great proof of concept with the ability to think that it can scale is not helping. It's just digressing because it doesn't have the thoughts of how it will be there. The next aspect is usability and user experience. It needs to be effective. It needs to be intuitive enough so that as a challenge, can we think of eliminating training?
Interesting.
That means it's so intuitive, it's so obvious. Not saying eliminate training, but
yeah, I know.
By actually solving the problem. Don't just eliminate training and say, you asked us to do so and here we are, we've done with it. No, not like that. And then look at an effective business and technology support model so that it lives through the time it is designed for. Look for intermediate checkpoints so that you check whether the intent of the design is actually serving the purpose that it is running on the ground for. And last but definitely not the least, cost. It has to be viable to the cost and the economics of the running organization and the industry in which it is there, and its business parlance, whether it is a public sector or a private sector or whichever be the case.
Absolutely.
Cost and its meaningful contribution to the economics of that particular segment is absolutely essential. I think all of this needs to be looked at, not just the hype of technology and the buzzword of technology. Sorry if I'm sounding to splash water on raging technology fire, but You really need to be practical if you're looking at solving a problem and
That's
not
true.
showcasing. We are not a lab here.
That's true. Atanuda, same question to you. Your concluding remarks on the essential prescriptive guidance you'd give a new generation of leaders on how to approach, I'll take a leaf from what Arvind said. Approach the whole hype of technology and put it to its accurate use.
So, I fully resonate with what Arvind said. I don't think I need to add anything to it. I fully agree with what he said, and I believe that. One more thing, if I were to add to it, is while you look at solving today's problem, which should be the focus. When you are creating that enterprise architecture, anticipate the problems of the scale up and what is going to happen in the future. And because we are not going to design applications and the enterprise architecture every day.
True.
So anticipate the business outcomes and the problems and the scale of the future and do that now. So that element of anticipation and building for the future is also an element which the IT leaders need to think through.
Fantastic, gentlemen. This has been truly an enlightening conversation, and I'm very, very grateful for that. That's pretty much what we have time for in this segment. Arvind sir, Atanuda, it has been nothing short of sheer brilliance. Thank you so much for your participation, sir.
Thank you, Arjun. Thank you, Arvind. It was nice speaking to all of you.
Thank you very much. And ladies and gentlemen, that was I, Arjun Vishwanathan, in conversation with Tanu Roy from Biocon and Arvind Sivaramakrishnan from the Apollo Hospitals. That's all from us in this segment. Stay tuned. We'll be back with the next segment in just a minute.